We're trying to develop a anti-inflammatory therapy for acute neurotrauma to reduce the amount of inflammation that takes place following a trauma to the spinal cord or to the brain. Because the sooner we reduce the inflammation, the more likely we're going to preserve and prevent the further loss of neurons in the damaged area. And when you lose neurons, you lose function. And so we're trying, this acute anti-inflammatory therapy is really can also be considered a neuroprotective therapy. It's come to light in the last several years that as Alzheimer's developed, there's also an inflammatory response in the areas of the brain that are critically affected by the development of Alzheimer's disease. And one of the critical questions we've wanted to ask is this purely an inflammatory response that arises only in the affected regions of the brain, or do inflammatory cells that can come in from the blood also contribute to the inflammatory response in the Alzheimer's area? If those infiltrating inflammatory cells coming into the brain from the blood are contributing in a negative way, adding to inflammation, adding to further exacerbating the loss of neurons, then potentially the therapy that we're trying to develop for preventing the infiltration of blood-derived inflammatory cells with neurotrauma might also be applicable to trying to see whether it would reduce inflammation in a brain that's developing Alzheimer's.